Hey everyone, and welcome to today's Explainer. I am absolutely thrilled to have you joining us because today we are unpacking some truly groundbreaking insights from the 75th webinar of the Egypt Microsurgery Group. If you're at all fascinated by the absolute cutting edge of human healing and surgical ingenuity, well, you are definitely in the right place. We're going to be looking at the pioneering work discussed by master surgeons like Professor Koshima and Dr. Karasu, exploring how they are fundamentally changing what's actually possible in complex facial and neck reconstructions. Okay, let's just quickly walk through our clinical roadmap for today. We have 1. The Reconstruction Challenge, 2. The evolution of super thin flaps, 3. The Orochi concept, and 4. Advanced microsurgery innovations. Let's get right into it.
Section 1, the Reconstruction Challenge, confronting complex defects.
So let's talk about the biological hurdles here, because when a surgeon is dealing with secondary reconstruction in the head and neck, they aren't just dealing with a simple wound. Far from it. They're fighting against irradiated tissue, which, as we know, has severely compromised blood flow. They're facing multiple cancer recurrences that completely alter the anatomy. They have to somehow avoid postoperative bulkiness, which can honestly ruin both the functional and aesthetic outcome for the patient's face or neck. And on top of all of that, finding healthy, appropriate recipient blood vessels to attach the new tissue to is literally like finding a needle in a haystack. To show you just how intense this gets, check out this staggering case study presented by Dr. Karasu during the webinar. To solve this massive defect in his patient, one piece of tissue just wasn't going to cut it. He utilized a double free flap technique. Specifically, he took a scapular bone flap and combined it with a radial forearm flap. Just imagine the sheer surgical choreography required to harvest, transfer, and successfully attach two separate tissue and bone systems into a highly compromised area of the neck. It's a total masterclass in selecting the right flaps and vessels.
Later in the session, Dr. Gamal brought up a fantastic point, asking specifically about the bone fixation techniques used in massive transfers like this. And while we don't have the step-by-step surgical breakdown for the bone fixation in our source material, the sheer anatomy involved reveals just how incredibly high the stakes are here. I mean, securing a piece of scapular bone into the delicate architecture of the head and neck, that requires extreme precision for long-term stability and function. You're basically looking at structural engineering happening at a microscopic level inside the human body.
Section 2, Evolution of Super Thin Flaps, a Historical Journey. To really appreciate how we solve these problems of bulkiness and tissue failure today, we have to look back at how we got here. Professor Koshima gave us this amazing historical overview, showing the shift from heavy, bulky techniques to elegant, hyper-precise microscopic methods. In the 1980s, we see the early development of super thin skin flaps. Then, a massive breakthrough hits in 1986 when Chinese plastic surgeon Dr. C2P presented the subdermal vascular network concept. Fast forward to 1996, Japanese microsurgeon Kimura reported on microscopic dissection techniques. And that brings us to today, where we have Professor Koshima applying these modern, hyper-thin techniques to surgeries like microtia or tongue reconstruction.
Now check out this contrast. It is night and day. The traditional Western approach often ended up sacrificing deep fatty tissue just to get the flap thin enough. But that actually led to higher complication rates because of the underlying anatomical differences. Koshima's approach totally flips this on its head. He emphasizes preserving the subdermal plexus and vascular perforators rather than destroying that deeper architecture. It's all about working with the body's microanatomy, not bulldozing against it, to make sure the tissue survives and thrives.
Section 3, the Orochi concept, mythic solutions for recurrence. So what happens when you face the absolute worst, most complex, irradiated, or recurrent cancer cases? Enter the Orochi concept. In Japanese mythology, the Yamashana no Orochi is an 8-headed serpent. And much like that multi-headed serpent, this highly specialized concept utilizes multiple, simultaneous tissue transfers to tackle massive defects all at once. We're talking about integrating multiple tissue components, particularly anterolateral thigh, or ALT flaps, combined with additional highly complex vascular anastomosis. This ensures every single piece of transferred tissue gets a robust blood supply. And get this. By using this multifaceted, highly complex Orochi concept, Professor Koshima achieves an astounding 97% success rate in recurrent cases. 97%. Think about that for a second. These are patients who have had multiple surgeries, extensive radiation, heavily scarred tissue, and yet by transferring multiple tissue components with independent blood supplies, the success rate is nearly perfect.
It is just a stunning achievement in modern medicine.
But, it's not just about surviving the surgery. It's about regaining quality of life. Professor Koshima emphasized several advanced strategies here. He highlighted the absolute critical importance of aesthetic reconstruction, even after massive radiation damage. He talked about handling severe tissue contractures. And he also brought up this super fascinating technique of banking and transferring tissue to use strategically for severe defects, completely customizing the flap design based on the very specific, unique geometry of the patient's defect.
Section 4, Advanced Microsurgery Innovations, the Q&A Pivot. During the discussion on these advanced techniques, a really fascinating comparison came up. On one side, you have the Da Vinci technique, the traditional method currently used in many Western countries for harvesting DIEP flaps. On the other side, you have Professor Koshima's innovative alternative, the pump-up bracelet insertion method. He introduced this as a safer alternative specifically because it brilliantly preserves that crucial deep fascia layer. And by doing that, it almost entirely avoids the post-operative bulkiness and complications that usually plague traditional flap surgeries. It's an absolute game changer for refining aesthetic outcomes. Which brings us to a real-world clinical question from the webinar. Dr. Gamal jumped in and put these theories to the practical test, asking, what is the best approach for hard palate reconstruction? And Professor Koshima's answer was definitive. While some might default to skin grafts, he says they are absolutely not recommended for intraoral reconstruction. The priority has to be muscle flaps. Why? Well, using a muscle flap inside the mouth drastically reduces postoperative tension. Plus, the muscle adapts to the wet environment of the mouth so much better, eventually giving you a far superior mucosal lining. It's all about choosing the biologically correct material for the specific environment.
Then, moving from the head and neck down to the extremities, Dr. Yusra posed another great question about microsurgery techniques. She asked, can tandem grafts be used for thumb extension? She was asking this specifically in the context of treating full sequence extensor tendon defects in the fingers.
Once again, Professor Koshima's focus on living, breathing tissue proved to be the superior biological solution. A non-vascular tendon graft might be the standard older approach, but without a dedicated blood supply, it can easily scar down or just fail. Instead, Professor Koshima firmly recommended using vascularized adipose tissue transfers. By bringing in tissue that has its own blood supply and using standard anastomosis techniques to hook those vessels up, the tissue heals faster, it glides better, and it restores that vital thumb extension with way greater reliability. And wow, that brings us to the end of today's deep dive into the Egypt Microsurgery Group's incredible session. From the mythic multi-flap Orochi concept to the precise elegance of the pump-up bracelet method, we are literally watching a paradigm shift in how surgeons rebuild the human form. So, I want to leave you with this final, provocative thought. As we move away from bulky, standard flaps toward these hyper-customized, microscopic, vascularized tissue transfers, how will these super-thin, fascia-preserving techniques continue to redefine the absolute boundaries of the human body's ability to heal itself? The future of super microsurgery is already here, and it is endlessly fascinating. Thank you so much for joining me on this explainer, and keep learning.